Hello and welcome to another session on health education by Dianai. Preparing for a discharge from the hospital can be an important step in ensuring a smooth transition to home care. It's important to understand the discharge process and what steps you need to take to ensure that your recovery is successful. Before you are discharged, your healthcare team will provide you with instructions for post-hospital care, including information on any medications you need to take, any follow-up appointments you need to schedule, and any activity restrictions you need to follow. It's important to understand these instructions and ask any questions you may have before you leave the hospital. You should also make sure that you have arranged for transportation home and that someone will be available to assist you when you arrive home. If you need additional support, such as home health care or physical therapy, you should make arrangements for these services before you leave the hospital. It's also important to have any necessary medical equipment or supplies on hand before you leave the hospital. This may include things like a walker, a hospital bed, or oxygen tanks. Your healthcare team can help you arrange for these items if needed. Once you are home, it's important to follow your healthcare team's instructions and to make any follow-up appointments as scheduled. It's also important to keep your healthcare team informed of any changes in your condition or if you experience any complications. In conclusion, preparing for a discharge from the hospital is an important step in ensuring a smooth transition to home care. By understanding the discharge process and taking the necessary steps to ensure that your recovery is successful, you can ensure that your recovery is as smooth as possible. Remember to follow the instructions given by the healthcare team, make any necessary arrangements and communicate any issues or changes to the healthcare team.